Hello and welcome back to Path to Nursing. Are you preparing for the NCLEX-RN? You're in the right place. In today's video, we'll cover 10 original NCLEX-style obstetrics practice questions on preeclampsia and eclampsia, one of the most important and frequently tested topics on the NCLEX. Read each question carefully, pause the video if you need more time, choose your best answer and then stay for the detailed rationale to strengthen your clinical judgment. Question 21. A pregnant client with severe preeclampsia is placed on seizure precautions. Which intervention is appropriate? A. Keep padded side rails in place. B. Keep the room brightly lit. C. Encourage frequent visitors. D. Place the client in the supine position. Correct answer, A. Keep padded side rails in place. Rationale: seizure precautions include padded side rails, reduced stimulation, and emergency equipment nearby. Question 22. Which symptom should the nurse instruct a pregnant client to report immediately? A. Mild ankle swelling. B. Occasional fatigue. C. Persistent severe headache. D. Increased fetal movement. Correct answer, C. Persistent severe headache. Rationale: a severe headache may indicate worsening preeclampsia and increased risk of seizure. Question 23. Which assessment finding suggests that magnesium sulfate should be withheld? A. Respiratory rate of 10 breaths/min. B. Blood pressure of 150/92 mmHg. C. Heart rate of 90 beats/min. D. Temperature of 37 degrees Celsius 98.6 degrees Fahrenheit. Correct answer, A. Respiratory rate of 10 breaths/min. Rationale: respiratory depression is a sign of magnesium toxicity. The medication should be stopped, and the healthcare provider notified immediately. Question 24. Which laboratory result is most concerning in a client with severe preeclampsia? A. Platelet count of 85,000/mm superscript 3. B. Hemoglobin of 12.5 g/dl. C. White blood cell count of 9,000/mm superscript 3. D. Sodium of 138 milliequivalent/L. Correct answer, A. Platelet count of 85,000/mm superscript 3. Rationale: thrombocytopenia increases the risk of bleeding and may indicate HELLP syndrome. Question 25. The nurse is caring for a client with eclampsia after a seizure. What is the priority nursing action? A. Assess airway and breathing. B. Offer oral fluids. C. Assist the client to walk. D. Encourage family visitation. Correct answer, A. Assess airway and breathing. Rationale: after a seizure, maintaining a patent airway and ensuring adequate oxygenation are the highest priorities. Question 26. Which position is best for a client with severe preeclampsia? A. Left lateral position. B. Supine position. C. High Fowler's position. D. Prone position. Correct answer, A. Left lateral position. Rationale: the left lateral position improves uteroplacental blood flow and reduces pressure on major blood vessels. Question 27. Which medication is most commonly used to lower severe blood pressure in preeclampsia? A. Labetalol. B. Oxytocin. C. Terbutaline. D. Methylergonavine. Correct answer, A. Labetalol. Rationale: labetalol is one of the commonly used antihypertensive medications for severe hypertension in pregnancy. Question 28. A nurse is assessing a client receiving magnesium sulfate. Which finding indicates the medication is therapeutic? A. No seizure activity. B. Blood pressure of 110/70 mmHg. C. Proteinuria has resolved. D. No edema is present. Correct answer, A. No seizure activity. Rationale: the primary therapeutic goal of magnesium sulfate is seizure prevention. Question 29. A pregnant client asks why urine protein is checked at each prenatal visit. What is the nurse's best response? A. Protein in the urine can be a sign of preeclampsia. B. It measures your baby's kidney function. C. It tells us if you're dehydrated. D. It measures your blood sugar. Correct answer, A. Protein in the urine can be a sign of preeclampsia. Rationale. Proteinuria is an important finding that can indicate preeclampsia when evaluated along with blood pressure and other clinical findings. Question 30, bonus SATA. A nurse is caring for a client with severe preeclampsia. Which nursing interventions are appropriate? Select all that apply. A. Maintain seizure precautions. B. Monitor deep tendon reflexes. C. Keep calcium gluconate readily available. D. Encourage a high-sodium diet. E. Monitor urine output. Correct answers, A, B, C, E. Rationale. A. Seizure precautions reduce the risk of injury. B. Deep tendon reflexes help assess for magnesium toxicity. C. Calcium gluconate is the antidote for magnesium sulfate toxicity. D. A high-sodium diet is not recommended for managing preeclampsia. E. Monitoring urine output is important because reduced kidney function can increase the risk of magnesium toxicity. Subscribe, and turn on the notification bell so you never miss a new NCLEX practice session.